Vaginal health is depends on, some will say that, the age of the woman. But apart from that, there are other factors which include the acidic nature. You know, vagina has a acidic pH. There is a normal acidic pH of a vagina, which should be kept natural, and that acidic nature level shouldn't be changed. This acidic content or acidic nature contains beneficial bacteria. So the word here is beneficial bacteria. We have bacteria which are beneficial, and by nature they are in the acidic nature or form, or at the acidic level, pH level of acidity at the vaginal area. And what these beneficial bacteria do is they try to keep off infections naturally. So that's the first point that we are, before we go to the practices and the ways. These are the points that I want you to understand. One, the acidic nature of a vagina, or the pH level of every vagina, should be acidic. And this acidic nature contains beneficial bacteria, and their activity of this beneficial, the word is beneficial bacteria, who drive in the acidic nature. And what they do is they fend off, they try to push off, prevents or deals with infections. A healthy vagina also secretes small discharge naturally. So it is normal when you feel some small discharges, and these discharges come to lubricate the place. This acidic fluid environment nature, which contains beneficial bacteria, normally cleanses the vagina, lubricate the vagina naturally. So it's normal when you see small amount of discharges. But when some of these discharges becomes, then it's trying to become offensive, or when it's overproduced more than the normal, then it tries to become offensive. The color changes and a whole lot. That's where the problem starts from. So first of all, there's a natural environment that cleanses the vagina by itself. And it is the acidic nature of the vagina, the pH level, which is acidity, that helps the vagina to cleanse itself from all infections. So if a woman experiences changes like vaginal odor, or the discharge is the odor is bad, the color changes, and you feel discomfort whenever the discharges are coming. Maybe some people feel itching at the vulva, some people feel burning sensation, some too have some vulvar discomfort, some people have pelvic discomfort. Then that calls for an attention. But aside that, when you see a discharge, it is normal for every woman for the vagina to have its normal cleansing activity. That's normally cleansing with the acidic fluids to kill the bacteria and the infections that are present there. So after establishing the basic principle of the vaginal cleansing, the vaginal cleaning itself, let's move to the practices of ensuring a healthy vagina or hygienic vaginal environment. Normally, as I said, the pH level of each vagina is 3.8 to 4.5. That's acidic level. When you check the pH scale, we have the acidic, the vaginal fluid that cleanses the vagina has acidic level or acidic pH. The pH level of the fluids in the vagina is acidic, and it ranges from 3.8 to 4.5. That's the acidic level of the vaginal fluids. And so one of the best ways to keep this vagina hygiene or your vagina healthy is to maintain the natural environment of the vagina, which is the pH level. So we have to maintain vaginal pH level. We have to always make sure that we balance it. And what are the things that we are going to do? Since when we are able to get the pH level to be in the normal state, infections will not be able to stay there. Bacteria, harmful bacteria will not be able to stay there. The beneficial bacteria will always keep on dealing with the infected ones or the infections that come away if the pH level is maintained without any other external causes or factors changing it. So first, point number one, let's protect and maintain the vaginal pH or the pH level of the vaginal fluid or our vaginal environment. One of the things that we do that changes the pH level of our vagina is something that we call douching. If you watch my other video, you see that I've done a video on a whole full video on douching. So douching can interfere with the vaginal pH level. You try to douche the vagina, try to bring things out. As I said, I have a full video on that. So this douching has a gross effect on vaginal health by changing the pH of the vagina. What's douching? The best thing that I can say douching can do is just changing the order at that time, but it will not change the cause of that particular problem, whether it's offensive or that you feel that you think you are douching, whether it's offensive discharges, whether it's itching, or whatever you feel that you want to douche out. Fine, when you douche out, it stops it for the temporal time or for the moment, but the cause of that needs to be attended to. So one of the easy ways or that we can easily change the vaginal pH is douching, which I'm advising or advocating that we should resist, we should stop douching. I have a full video on the douching that when you check my channel, you will see that I've done a video on the douching. Some people have a strong vaginal odor which is very unpleasant. If it is so, just see a doctor. Avoid using harsh soaps or cleanser. You see, some people use hard soaps. Detergent, a whole lot of, some even use washing powder and a lot of hard and harsh detergents to wash with the intention of trying to douche or get rid of what is causing that infection. But the infection came just because there is a change in the aura. We call something aura, the natural environment of the vaginal orifice or the vagina. So the moment the environment changes or the environment, the pH level of the vagina is changed, automatically you are going to get infection. So it's not about the douching, it's about trying to maintain the normal pH level of the vagina. Mind you, I said the pH level of the vagina ranges from 3.8 to 4.5. That's very acidic or somehow acidic, if I should say. So let's try as much as possible not to douche. Let's avoid ourselves from the harmful effects or the practices that will cause the change in the environment or the change in the pH level of our vagina. And one of the things that we should be doing is to avoid douching, avoid using harsh detergent, avoid using harsh soaps, trying to bring things out so that our pH level will be normal at our vaginal orifices or environment to maintain a vaginal health. All the points that we can or ways that we can maintain vaginal health is to have a healthy diet, a balanced diet. So as much as we want a healthy or hygienic vagina, it means we should also check our diet, because the kind of things that we take in, the things that we take in has direct consequences on our vaginal health. So some people just take in some things, but one of the things that we should be mindful of is drinking a lot of water. You should take in a lot of water, fluid. Take plenty fluid. That's number one. Take plenty fluid to maintain a vaginal health or a good vaginal hygienic condition. Make sure that you eat a balanced diet. I've talked about that. That's point number 2. In fact, certain foods can be effective in treating vaginal health problems. There are some foods that can be very effective when we want to treat vaginal problems. And one of the foods includes yogurt, which helps in yeast infections and aid in the treatment of the yeast infection. I have another video on diets, special diets for vaginal health. But I want you to know that diet, well-balanced diet, and a good diet, appropriate diet, has direct impact on your vaginal hygiene or vaginal health. Point number 3, we should practice safer sex. The word is safer sex. We should make sure that we practice safer sex and to keep away from harmful germs. So we should make sure that in our sexual activities, everything that we indulge in, we practice is safer. We should use condom when we don't feel safe to prevent or protect ourselves from STIs. We should use condom. We can use this condom to protect ourselves from all other infections, including the HIV, the human papilloma virus, and other STIs, syphilis, gonorrhea, as I talk, STIs. Condom, being a safer method, can help us to prevent these infections. So if we keep away, we practice good or safer sex practices, there's no way we are going to have infections introduced into your vaginal orifices or your area, but rather have a healthy vagina. One thing is, we should also try to change condoms when switching from oral sex to vaginal sex. It's very important that people don't do. You have to change. You should change condoms when you are switching from oral sex to vaginal sex to prevent the introduction of harmful bacteria into the vagina. So sometimes you had oral sex. So moving to the penny, or for the anal, the sex, the orifices, that's the vagina. You should make sure it's either you wash up, you clean, you make the place very clean. That's because you introduce something into your mouth and you are bringing your mouth, the harmful, the bacteria in our mouth are quite different from bacteria in our vaginal orifice. So anytime somebody is introducing the mouth or whatever into the vagina, we should make sure that it's very clean. So switch from, some people have anal sex, and after anal sex, instead of them to change the condom from the anus straight into the vagina, you've introduced foreign bacteria, foreign substances into the vagina, which will cause a change in the vaginal environment, thereby leading to vaginal infection, and you are not safe. You are not going to have healthy vagina. To make sure that you see your gynecologist or you see a primary care doctor when you have any issue with your reproductive system. So that we should have regular gynecological exams, which is very crucial to maintain our vaginal health. It's normal for you to avail yourself for you to be examined gynecologically. It is recommended that at least you should have your first screening from the gynecologist at the age of 21. Any lady, at least by the age of 21 years, you should have gone for gynecological screening or examination. So let's not try to be doing self-medications when you have issues with our vaginal orifices or problems with our vaginal environment and stuff. But let's try as much as possible to see the gynecologist, or try as much as possible to see primary health doctor for them to give us appropriate. I have a video on this antibacterial resistance. You see, the antibacterials that we use, we try to introduce by ourselves without knowing the exact bacteria or whatever virus which is causing that particular problem. I have a video on that antibacterial infection or resistance that you can check, and is what these are some of the practices. We try to use our own drugs, try to treat it, and the virus and the bacteria develop resistance. So let's try as much as possible to avoid doing that. But the best way is to see the gynecologist as early as possible, or to see a doctor to report our case to as early as possible. So the next point is, in order to keep a healthy vagina or to maintain good vaginal hygiene, you have to make sure that you treat infections as soon as they arise. As soon as they arise, you see, you don't have to wait for the infections to be with you for a longer period, because in as much as they wait for a longer period, or you wait for a longer period before you attend to them, they develop resistance, they grow, they can cause harm. So one of the best ways to keep that, the moment you notice there's a change, there's a problem that you need to deal with it as soon as possible. So the next point that I'm going to talk about is to have enough lubrication. Use enough lubricant, but note, it's not petroleum jelly, not any substance that contains petroleum jelly. When we talk about having a vaginal hygiene or a healthy vagina, one of the things that we should consider, as I said earlier in my earlier submissions or in my earlier points, that we should have enough, or the level of our fluid should be acidic, but the fluid should be enough. You see, the ability of the fluid to clean is, you should have enough. It shouldn't be dry, it shouldn't stay dry, but there should be some kind of lubrications, natural lubrications. So to have a healthy vagina, it's very important to have lubrication. 2, lubrication is an essential part during intercourse. So you have to be well lubricated naturally. But some people can't naturally produce enough lubrication due to other factors or several factors. So you have to introduce artificial lubricants. But this time around, make sure you choose the right one. Those that don't contain petroleum jelly. Those that are not going to change the pH of the vaginal environment. So lubrication is very important. Without it, you are going to stay dry, and during sexual intercourse, when you are going to get cuts, the labia minora and the labia majora and the walls, the linings of the vagina, you can get tear. And the moment you get tear, you will be prone to infection. Or if there is any other infection available, or the person is infected, whatever, there's going to be a problem. So let's try to be lubricated. If you want to use lubricants, artificial one, to enhance your lubrication, please don't use those that contain petroleum jelly. They can change the environment of the vagina, thereby introducing you to or making you prone to infection. Some people too are pregnant. If you are trying to get pregnant, there are certain lubricants that you cannot use, because they can interfere with the sperm production, or it will make it very difficult for you to conceive. So there are some lubricants that you are not supposed to use when you have the intentions of getting pregnant. So in the process of getting well lubricated, if you are not naturally lubricated, that's during sexual intercourse, or you don't have enough lubricants naturally, the fluids that can cleanse the vagina naturally, you have to get artificial lubricants. But note, they shouldn't contain petroleum jelly, which can cause or alter the acidic environment of the vagina, thereby making you prone to infection. One of the points too, the next point that we can practice to have a healthy vagina is to know the best and appropriate clothing that can help us to stay dry, or that can help us to have vaginal health. Your vagina should stay clean and dry, and what you wear can affect you. Your vagina should stay clean and dry, but what you wear can affect certain types of fabrics and tight clothing can create warm, moist conditions which yeast can thrive. So there are certain types of clothing that we choose. Very tight, the fabrics can make us prone to. So we should be very selective in the kind of, we should be conscious in the kind of clothing that we choose in order to stay dry. We have intentions of staying dry, but at the end of the day, by doing that, we rather create moist environment, and this moist environment is, the best environment for infection or these disease-causing organisms to stay. Thereby, we have to try as much as possible to know the type of clothing that we should wear to maintain a healthy vagina. Next is we should have a good hygienic practices. You see, normal common sense or whatever will tell you that is one of the best way to have a good health is to have good hygienic practices. The same thing applies to have a vaginal health. You have to do or enforce or ensure vaginal hygienic practices. One, when you go to the WC, the washroom, and you want to wipe, as a lady, we all know that, or if you don't know, try as much as possible to wipe from the front to the back. Wipe from the front to the back. Don't try to wipe from the back to the front. If you do that, you are rather introducing foreign materials from other environments into the orifice. That's the vaginal orifice, which it is going to change the natural environment of the beneficial bacteria there. And if that happens, you are prone to infection. Stay tuned. This is Health Matters on Gene Studios. You can follow, subscribe, like, and share. Your comments are also welcomed on the Health Matters platform. My name is Village Doctor. See my other videos for education. Thank you.